Hi, I'm Nathan. I'm from the Filipino Institute of Public Health. Now, tuberculosis transmission is very well documented among healthcare workers and in healthcare settings. We know that people receiving healthcare in the Philippines, as well as healthcare professionals, have a much higher incidence of contracting tuberculosis, and that's why there's tuberculosis control procedures in place to try and minimise this progression and transmission of tuberculosis. So the tuberculosis infection control plan has three main goals, and it's designed to ensure that there's prompt detection of infectious patients, appropriate treatment of suspected and confirmed tuberculosis cases, and that airborne precautions are taken by all patients and staff members involved in tuberculosis. The tuberculosis infection control program is based on a three-tier hierarchy of control measures, and those three tiers include administrative controls, environmental controls, and the use of respiratory personal protective equipment. So administrative controls are those which are implemented at the first level of the hierarchy, and they'll be implemented by the facilities that you'll be working alongside. So they include measures such as a written tuberculosis control plan, proper cleaning and sterilisation of equipment that's come into contact with tuberculosis infected patients, appropriate education of staff and patients in high risk tuberculosis areas, as well as posters and signs reminding staff of cough etiquette and other techniques like that. Environmental controls include primary and secondary environmental. Primary environmental controls would be controlling the source of infection by using local exhaust ventilation, or in the case of ambulance, increasing the ventilation in the ambulance so that you're not exposed to such high concentration of contaminated air. Secondary environmental controls revolve around quarantine and isolation of infectious patients. So within the hospital environment, once you transport those patients, they'll actually be put into an isolation unit so that the air that they're exhaling is not being exposed to the other patients in the hospital. The third tier of control for tuberculosis is the use of respiratory personal protective equipment. So this is used by both healthcare professionals and infected patients to prevent and reduce the spread of tuberculosis. So essentially it's the use of face masks. If you're working with a tuberculosis patient, you can place a face mask on the patient as well as yourself to prevent the transmission, because we know that tuberculosis is mostly or entirely transmitted through airborne and droplet nuclei. The other thing is using appropriate cough etiquette and sneezing etiquette, and appropriate hand washing.